Together and we'll call the roll. Good night, Adam. And with that, let me call the meeting of the Board of State and Community Corrections to order and welcome you all here. I'd like to thank California Sheriff's Association and Carmen Green for their assistance on putting this remote meeting together, and welcome all the board members and thank you for traveling. With that said, Adam, begin your duties and start calling the roll.
Sheriff Gunner.
Here.
Mr. Kernan. Here. Mr. Powers. Here. Mr. Gradden. Here. Mr. Dean.
Present.
Mrs. Perez.
Ooh.
Well, Letitia is here.
We can check on her status.
Well, she should get here. This will be an unexcused absence because she has been seen in the hotel.
Ms. Brown. Here. Mr. Rotola. Here. Judge Garrett is absent today.
Yes.
Mr. Bejarano. Here. Mr. Budnick.
Here.
Mr. Steinhardt is also absent today. And Mr.
Here.
Thank you. And briefly on Judge Garrett, she is going to, or has submitted her resignation from the Board of State and Community Corrections. She's had a very difficult year. She lost her husband of 37 years in January, and that was closely followed by the death of her father. And I think that she is doing those final arrangements for all of their outlying issues and is just overwhelmed. So we have the Chief Justice is looking for new membership. If anybody has any suggestions or ideas, Katie's open and ready to take those. And Mr. Steinhardt had a conflict in the legislature, I believe.
That's right, Madam Chair. David Steinhardt is at the Senate Budget Subcommittee today, and that's why he's not here.
And following the formal adjournment of the meeting, we will meet in closed session briefly.
Good morning, Madam Chair. Yeah, I don't think closed session will be necessary today. We'll do the legal update, but I don't know if there's any closed session discussion.
3 cheers for no closed session, and we'll move on. I'm buying time while we wait for Supervisor Perez. And not to diminish this at all, we could do your report.
Oh, I would be happy to do that, and I will speak smoothly on this. Good morning, Madam Chair, members of the board. Welcome to San Bernardino County. I would also like to thank the State Sheriff's Association for their hospitality. This is a great meeting place, and it's really, I think, beneficial for the board to have a couple of travel meetings each year. So thank you all for being here. I would like to join Linda in welcoming Adam to his new role. And here comes.
Oh, there she is. So nice of you to show up.
I've been lost for 10 minutes.
Oh, no.
I mean, honestly, I'm sorry. I got totally turned around. I blame Linda Henry.
Yes, yeah.
Because Antonio, if you could cut Mr. Budnick's mic. No.
Nice guy.
Thank you, Supervisor President. Just beginning the Executive Director's report, and I'm happy to be here. We will be recognizing Maria Rodriguez-Rieger's service as Executive Secretary to the board when we are in Sacramento in June, and I'd like to join Linda in welcoming Adam to his new role. I have just a few things to give you updates on. It is the season of budget subcommittee hearings. We were on the agenda earlier this week, Monday, in the Assembly Budget Subcommittee. It was very, very brief. There were a few questions about the Proposition 47 annual savings calculation, and no action was taken. The issue was held open, and there were no other questions pertaining to the BSCC budget. So that was fairly easy, fairly routine. I would like to congratulate both Sheriff Groudon and Chief Rotola. They were confirmed in the Senate Rules Committee last week. Would either of you like to say anything about the confirmation hearing? It was a unanimous vote, seemed to go well. There were some questions, but I think you all got through it.
Am I going?
No.
There we go. It was a bit stressful, I thought, for both of us to get through, but I think we asked some very valid questions of the BSCC and information that they wanted. And I think we supported the BSCC in areas, and we also showed some areas that maybe some other research needs to be done regarding such things as OC.
Great.
I think overall,
Thank you, Chief. And congratulations to both of you. Sure. Okay, great.
I would like to
Oh,
interject.
please, Madam Chair.
I realize it was stressful. They don't often call board members for confirmation hearings, and I thought you represented really well informed. And we really appreciate all you do. I know it's for this very high rate of pay you get from the BSCC. Oh, we don't pay you. Great. So but it was really a positive day for us, even though you may have been slightly stressed.
Thank you both. Let's see, I'd like to mention, last week, as you may know, there were a lot of events in Sacramento focusing on victims' issues. I was invited to speak at a large event called Survivors Speak. I was on a panel with Undersecretary Diaz and Maurice Edwards and some representatives of other state entities that are involved in Prop 47 related grant making, like the Office of Emergency Services and others. It was a very positive event, and I was happy to be there talking about the board's work, Prop 47 connected. Also on Prop 47, I'm really pleased to let you know, as I'm sure you remember from reading all of the text of Proposition 47, one of the responsibilities that was in the initiative was for a fairly robust audit process, and the state controller's office has concluded the first audit with respect to this board's grant-making responsibilities, and we had an exit conference yesterday. I'm very pleased to let you know there were no findings and no recommendations, which means we got an A on our audit. I don't know why Linda just gave a big thumbs up. Was it because of the audit?
We were just supporting you in your.
Thank you.
No, actually, they wanted to close the door.
Oh, very good. Okay. And I just do want to give a shout out to our amazing staff who put in a tremendous amount of work. I may be forgetting some names, but Mary Joel is the division director over grants. Juanita Renaka, Rosa Pargas, and Melinda Gillies, I know, put in hours and hours of prep on that. So their work was reviewed carefully, and there were no findings or recommendations out of the State Controller's Office. I also want to mention that I'm really pleased we have an information session for you today on the agenda coming from the Mental Health Services Oversight and Accountability Commission, one of our easier state acronyms, NHSOAC, not to be confused with Comio, which now has a new name, not to be confused with the many other entities that are doing important work in this arena of addressing mental health issues for people in the criminal justice system. We're really fortunate to have Sheriff Bill Brown from Santa Barbara County and Ashley Mills, who's a senior researcher with the Mental Health Services Oversight and Accountability Commission here today with us. This concludes my report, and I'm happy to take any questions that you may have.
Any questions of Katie? Erin, any legal report at this moment?
Oh, you can just reference the report.
I'm going to cover the ledge update, which is to tell you that the report is in your book as well. Thank you, Madam Chair. A couple of things that I want to update the board on in terms of some of the legal issues that the board has been facing. First of all, I wanted to mention an agenda item that will be on the next board agenda dealing with the delegation of some authority to our executive director. We have completed our first jail project in SB 1022, which will then result in the sale of bonds. And there are some certain legal documents that have to be executed in order to allow that bond sale to go forward, including the execution of certain lease agreements and sublease agreements as part of the financing for those projects. So as part of the agenda item, the Attorney General's office, in order for them to issue a clean bond opinion, has requested of us to make sure that the board very clearly delegate authority to our executive director to execute those contracts. So we'll be seeing that agenda item in June, and we'll have those documents for the board to review if you'd like to take a look at that as well at that time. Another issue that has recently popped up related to visitation, we were dealing with an issue that came out of Yolo County. You may recall in this prior legislative session, there was a compromise that was reached with respect to what extent counties would be required to maintain their in-person visitation policies. In this case, Yolo was constructing a new facility But as part of that construction, they were going to take down their existing in-person visitation space. We reached out to Yolo County and suggested that they take a look at the legislation that was AB 103 and asked them how they intended to comply with that legislation, which requires counties to maintain their in-person visitation space. Yolo County, after some exchanges back and forth, has agreed that they will actually construct additional visitation space as part of that new county facility so that they may maintain some in-person visitation space and supplement using video visitation, which will comply with the law. And we've notified Yolo County that they are going to be able to proceed on that basis as well. Any questions on that, Madam Chair? Seeing none. Also want to do a brief update on the new, ongoing and also new litigation involving, in part, the Burn Jag funds. You'll also notice in the book, we received a document request from the federal government as to the policies and procedures that the BSCC gives to its law enforcement employees in terms of immigration enforcement. You will see our response letter back to US DOJ that says that the BSCC does not have any law enforcement employees, and to provide them further additional information that the California Department of Justice would be also supplying some additional information as a Burn Jag grantee with respect to their law enforcement officers. The litigation regarding Burn Jag, you may recall, the state was asking for a preliminary injunction, and the federal government was asking for a motion to dismiss that case. Both parties lost out, so the motion for preliminary injunction was denied by Judge Orrick in the federal case, as well as the federal government's motion to dismiss was also denied, which means that a trial date has been set for the Burn Jag litigation out to September. And what that really means is that we will not see, almost certainly won't see any release of Burn Jag funds to the state of California until the litigation is resolved. So we're looking at several months, if not longer than that, to resolve some of those questions. Also wanted to mention as well that in March, the U.S. government, in a new proceeding, filed suit against the state of California to enjoin 3 different laws that were enacted dealing with immigration in some way, including Senate Bill 54, which is at issue in the Burn Jag litigation as well. That motion for preliminary injunction in that case is set for early May, and it may impact the results of whether or not the state is found to be in compliance with 8 U.S.C. 1373, which we've discussed multiple times. And with that, I think that is the conclusion of my legal update.
Thank you.
I have a question, Chair. Thank you. Aaron, I've been hearing rumors of changes to Prop 47 potentially, or other reform measures that the governor has pushed or not. Can you give us an update? Is this the appropriate place for that, or if there's a better place later in the agenda? Linda, please let me know.
Yeah, I mean, I can speak to that just very generally. There's been a couple of different bills, certainly over the last couple cycles, to address some issues that have been raised with Prop 47. I think the most, there's been some to require, for example, DNA testing or taking DNA samples of people who are arrested for crimes which are no longer considered felonies under Prop 47. So there's been that effort, and there's been different legislation to either recategorize theft again, to either reinstate petty theft with a prior in some way, shape, or form, or to allow for the aggregation of dollar amounts in order to get to the $950 threshold to provide for a felony. For the most part, those legislative efforts have not been successful. So there is there is a ballot initiative that is currently out for circulation and gathering signatures.
Okay.
And I can get you that information if you'd like that information as well.
Okay. So is that impacting our 47 operations at all?
It won't impact our 47 operations at all, and as much as the grant cycle and the funding that's provided in the current grant cycle is sort of set aside. So regardless of what happens, I mean, I'd have to look at the timeline exactly to figure out, but the savings calculations which are deposited for our expenditure have already been done. And what the changes might do is, to the extent that it changes the law so that additional people might be going to state prison in the future, that would certainly affect future savings calculations as a result of that. But as far as I've seen, there's not a wholesale proposal to change the grant structure that would impact the board. We would continue to get funding, which would be distributed. If there's less funding in the future, that would be part of those changes.
Very helpful. That's all. Thank you, John.
Any other questions?
Madam Chair, just, Karen, you mentioned the other day when you briefed the sheriff's meeting on the retroactivity on burn jag.
Yeah, so we did receive some additional information from BJA that was interesting, which was that they indicated that, and in prior years, they've allowed for expenditures of burn jag funding to be reimbursed following the award of that money. And the suggestion that's being made by BJA is that even though that the grant monies are basically on indefinite hold while the litigation proceeds, that the feds, once those awards are made, would allow for reimbursement back to October of 2016. Now, so to the extent that there are burn jag programs that are ongoing in the state, theoretically it would allow the counties to continue to operate those programs, assuming that they have the sufficient resources to do it themselves, and they could then seek reimbursement if and when the burn jag money is actually awarded. The complication of that, of course, is the feds are currently suggesting, even though we haven't received any formal notice, that the state's going to be ineligible for burn jag funding because of SB 54. So to the extent that counties are willing to continue operating under the hope that they get reimbursement in the future, that would be up to the counties, but it certainly is at least something that counties can contemplate as they're funding existing programs that are working well for them. There might be an opportunity for reimbursement in the future.
And I don't know if BSCC has sent written notification out to the recipients. Those of us in the room that live this know what's going on, but there could be awardees out there that are operating and don't realize that, in fact, they may not end up with their money. And for some counties, that can be a significant impact.
Yeah, I think we've done, I'm going to look back to Mayor Jones on this. Some grantees have actually wrapped up their programs. There are others that are finishing out and spending down their existing pots of money based on on the no-cost extension. I think the counties are aware that we haven't put out an RFP, and doesn't seem to be one coming in the future, but we'll certainly, I think, follow up with that additional information that BJA put out about potential future reimbursement, as well as letting them know, again, that based on litigation, that we don't see burn jag in the near future.
And I don't think we've done a blanket explanation of what's going on with burn jag out to all counties, and it's probably necessary just to sort of quash some of those questions.
Yeah, especially with the recent information. The state of the litigation has been complicating things, and the messages that were coming out of BJA were not entirely consistent with what was being represented in court, certainly. I think some folks at BJA were under the impression that maybe the funds would be released in another recent statement. The feds have asserted that even though Congress has appropriated this fund for the federal fiscal year, that they're under no obligation to actually award that funding in the federal fiscal year, which is an interesting idea. And certainly I know there will be some discussions as to whether or not that's allowable. When Congress tells an executive agency to spend money, they're usually required to do so. And there's some prior case law on that issue as well. So that may come up as we get, I think certainly as we get to the end of the federal fiscal year, that'll be another discussion that will be had in a future board meeting.
Any other questions? Okay, moving on. And now I would like to invite Ashley Mills and Sheriff Brown to the podium to discuss a subject matter I think that is very timely and important, and We're really honored to have you here. Just to brag on Sheriff Brown just a bit, he handed over the gavel, his own gavel, not my gavel that Adam brought me. But he handed over the gavel as presidency of CSSA last night, and I really enjoyed your remarks. You did a great job in the year you're in. I think you'll be missed. But happy to see that you are still going to be overcommitted and doing many, many things. So your leadership on this is huge. So take the effort, Sheriff.
Well, thank you, Chair Penner, and thank you, members of the board, for giving us some time today to present a report that is very near and dear to my heart and to the staff of the MHS-OAC. As I think everyone on this board is well aware, one of the great policy failures of our time has been the dismantling of our state's mental health care institutions without the provision of adequate community-based care in their stead. And as a result, we have seen a marked increase in the number of severely mentally ill people, many of them suffering from co-occurring substance abuse disorder and homelessness, coming into contact with law enforcement officers. And those confrontations are frequently disruptive, dangerous, and sometimes they are deadly. And more often than not, these encounters serve as a gateway for mentally ill people to enter the criminal justice system. Our jails have become the state's de facto mental institutions. And we believe, after studying this problem, it doesn't have to be that way. For about 2 years, 2016 to 17, I had the honor of chairing a committee on the MHS-OAC that took a look at the problem of mentally ill people and the criminal justice system. And we looked at this problem from a variety of vantage points. We wanted to see what it is that could be done better to divert people out of the system that could be diverted. And for those who had to stay in the system, how could we provide better mental health care for them? And what we did is we traveled and looked at a number of locations across the country and throughout our state that have some model programs and some model strategies on how they're addressing this problem. And in addition to several fellow commissioners and MHS-OAC staff, we were very fortunate to have your chair, Linda Penner, travel with us to look at some tremendous programming that is being done in San Antonio, Texas, and in Miami, Florida. And this report that we're presenting to you today is a report that has been designed for the use of law enforcement executives, mental health leaders, county executives, members of boards of supervisors, state legislators, the governor, and interested persons alike. And it is a look at the intersection of mental illness and the criminal justice system. And we believe that this report, which we purposely designed to be succinct enough to be read and not to simply be placed on a shelf and gather dust. We believe that it is something that encapsulates the problem, and it contains a creative and achievable approach for counties to reduce the number of mentally ill people who are entering California's jails, and that it is a roadmap to providing better mental health care and treatment for those who must be kept in custody. We recognize that the fiscal and the human resources in all forms of government are under incredible strain right now and in very short supply. We are facing financial difficulties in our state and throughout our counties. And in many cases, the resources that we have are stretched to the limit. But we have seen, particularly in San Antonio, how communities facing similar challenges have successfully come together to solve some key parts of this very vexing problem. And although the approaches were varied, what they had in common was a collaborative spirit of goodwill, bringing people from different disciplines together, and a resolve to combine their forces, to share their resources, and to solve the problem collectively. Everybody was able to take a piece of the problem and work towards a solution. And we strongly believe that now is the time to implement these recommendations. Now, we recognize that not every county will be in a position to be able to implement every recommendation that is in the report. But we recommend that counties take a strong look at 3 priorities Number one is collaborating and combining resources to effectively address the problem. For too long, we've operated in silos, and we haven't made the best use of the collective resources that are there in our communities. And there's duplication of effort, and there's money that's wasted that could be put to better use if it were combined. And for too long, we've operated just as county government and not reached out and brought people from the private sector, from community-based organizations, individual donors, people in the hospitals. All of these people have and these organizations have a role to play in combining our efforts and working together to address the problem. The second recommendation is that counties provide crisis services and other alternatives to custody for mentally ill persons. If we're going to divert people from jail, we have to have somewhere to divert them to. And it's important that we have those locations and that we have adequate community-based care as an alternative to putting someone who's mentally ill in custody, where they're likely to become worse off instead of better off. And then lastly, we have a huge problem throughout our state with incompetent to stand trial, IST inmates. And we recommend expanding jail-based and community-based restorative services. This is a statewide problem that congests our courts and overcrowds our jails, and effective prevention and early diversion strategies can reduce the number of people who languish in jails for months at a time until they can be restored to competency, or not restored to competency and end up going to a state hospital. Counties should also consider implementing or expanding both community-based and jail-based competency restoration programs so that the restoration process can take place outside the confines of the jail as well, if that's appropriate. I want to just say a quick thank you to my fellow commissioners on the MHSOAC and to the many mental health stakeholders who provided very valuable input into this study. I want to extend my appreciation to the staff of the MHSOAC, particularly Executive Director Toby Ewing, who has been tireless in his efforts, and to this wonderful person on my right, Senior Researcher Ashley Mills, who took the lead on this report and whose yeoman effort is very apparent when you read what she put together. Thank you for your hard work and for the collaborative spirit that you exemplified, and I think that is really what this report is all about. Together, we can. I think if we take those examples and those efforts of how this report came together, and if we can spread that word throughout our state, I think we have a very good shot at doing a much better job of dealing with this terribly vexing and chronic problem that we all suffer in our communities. So without further ado, I'd like to turn the podium over to Ashley, and she'll walk you through the basics of the report. Thank you very much for the opportunity to be here.
Thank you so much, and I just wanted to once again acknowledge the leadership of Commissioner Sheriff Brown, who has been tremendously supportive of this project. And I know that he's very busy, but he always makes a lot of space because I know that this is an issue that is particularly he's concerned about, and our commissioners are very concerned about. So thank you again for the invitation to present before the board. I'll provide just a brief overview. I have a PowerPoint presentation we'll be going through pretty quickly. If I can advance the slides. There we go. Okay, that's us. As Sheriff Brown, Commissioner Brown had provided an overview for you, we've had a number of engagement efforts in the community, from public hearings to community forums with site visits, both here in California and nationally. And what we were able to confirm was that the criminal justice system here and other places is overwhelmed by a population that it was never designed to serve. I'll give you some statistics to highlight some of the problems. It is estimated that 1 in 5 adults in the United States will experience a mental illness, with 5% meeting the criteria for a serious mental illness. Of those incarcerated in our local jails, it's estimated that approximately 17% have a serious mental illness. That's a rate of over 3 times as many in our general population. So we sought to better understand what was driving these startling statistics, because we know that simply having a mental illness alone does not necessarily increase someone's chance of becoming involved with the justice system.
but it does make people a little bit more vulnerable. I'll give you one more example. It's estimated that about 4% of community violence is attributable to mental illness alone. That means 96% of violence is driven by other factors like substance use and poverty. And the report outlines in detail how personal and environmental factors increase a person's chances of becoming involved in the criminal justice system. And then also how these folks are just more vulnerable to those factors. So we've outlined some solutions within the report, both generated by the research literature and also from the communities that we spoke to over the last couple of years. People with mental health needs require services in the community, appropriate culturally responsive treatment that addresses not only mental illness, but also housing deficits, substance use, trauma, other risk factors for offending or criminogenic risk factors. And these are all contributing towards a person's diminished recovery. Recognizing that people with mental health needs are better served in the community, there are efforts underway. One of those efforts is through something called the sequential intercept mapping process, and that is the diagram that's up on the board for you. And what the sequential intercept map does is it highlights different areas within the criminal justice system where there are opportunities to identify and divert people with mental health needs who could better be served in the community. And you'll see that there are a number of different intercepts, if you will, ranging from community intervention to law enforcement to diversion from our jails at booking, diversion from our court system. We have a lot of mental health courts here in California. There's also diversion opportunities when people are leaving our institutions and coming back into the community. And then finally, opportunities within our community corrections, our probation system. And the sequential intercept model is usually presented as it is up on the board linearly. It really is a circle. So as people are going through community supervision and they're being released, it all goes back to the community. It all goes back to intercept 0. Often, however, these services that are designed are distributed through multiple public programs and agencies. The variety of funding streams and eligibility requirements for disparate agencies complicate the coordination of our service delivery, and it makes it difficult to fill gaps in our services. And I've been told that you may be particularly interested in page 52. And I want to acknowledge Deputy Director Joles and her staff for helping the commission compile the information for the table that shows a number of our counties that are receiving grant funds, but then also some examples of how our communities are leveraging different grants. So for example, Proposition 47 grant in Alameda County, that county is using Proposition 47 funds, also AB 109 and Mental Health Service Act dollars, in addition to a number of other funds. So there are examples in our community where communities' programs are blending funding sources to address the needs. And then finally, our solutions are really emphasizing prevention. How do we design our system to prevent incarceration from happening in the first place? We know as soon as somebody enters the criminal justice system, whether it's their first time being arrested or booked into jail, it increases their likelihood of becoming involved with the justice system again. And so we'll be visiting this a little bit later on in the recommendations, but I just wanted to highlight prevention opportunities that are available. Excuse me. So moving into the recommendations, the findings and recommendations, I've outlined a number of challenges for you. The report outlines a number of our challenges. So we sat back and we reflected on what's required of us, what's required of us on the government side and on the community side. And in general, these are some guiding principles. What we found is that improving outcomes will take leadership to prioritize prevention and diversion of people with mental health needs from the criminal justice system, capacity to deliver community-based alternatives to jails, collaboration among community members, public health, and public safety leaders, an equitable system that recognizes and responds to long-held mental health and criminal justice disparities, and service integration that addresses complex co-occurring needs. I think it bears repeating, people who become involved with our criminal justice system, especially repeatedly, who have mental health needs, also have significant physical health issues, substance use issues, large amounts of housing instability over the course of their lifetime. So I'll briefly go through the findings and recommendations. There we go. The first recommendation, there's a lot up on the screen. I'll give you a brief overview. It's really directed towards supporting our counties to do local planning and really encouraging our counties to do local planning amongst different partners. Right now, in California, we have a couple of different planning mechanisms for different funding streams. So the Mental Health Services Act has a community program planning process that they go through. Some involve criminal justice partners, some do more than others. And then also the AB 109 funding, as you're very much aware, has their own planning process that again involves mental health or behavioral health leadership, but in very different degrees. And so this recommendation is really an acknowledgement that our communities and our counties are well equipped to better understand how funding streams can be leveraged and how outcomes can be improved. This can be done through the sequential intercept mapping process or a number of other planning strategies that really look at the system as a whole. The second recommendation, I wanted to spend a little bit more time just briefly on. There's a lot up here again, so I wanted to unpack it a little bit. And this is the recommendation that is specific to the board. We talked very early on with board staff about a potential recommendation and what would make sense kind of given your mandate around how to support sheriffs and jail administrators for people who cannot be diverted from our system. And so what we heard loud and clear was that our current system, because of public safety realignment and a number of other policies, have really shifted a population to our local correctional facilities that don't necessarily have just the physical space to be able to deliver programs and services for a population that has such high needs. And so this recommendation is recommending that the board act as a convener. A convener to get sheriffs, local decision makers around our local correction system and kind of figure out what we can do working within the limitations of our current system. There's also recommendations around universal screening for mental health and substance use disorders at booking, along with timely follow-up assessments. There is really exciting, promising research around trauma-informed correctional care, and outcomes have been seen in studies that support mental health, delivering mental health services within jail settings, and then also reducing recidivism through trauma-informed correctional practices. And then finally, training to support mental health awareness for correctional staff and then people under their custody. And I wanted to acknowledge the leadership of Deputy Director Garner, who has really been spearheading an effort within the board to improve those standards around training and support. And so I just wanted to say that the commission is here to support those efforts and any future efforts moving forward around developing training standards. The third recommendation, Sheriff Brown touched upon, is around the incompetent to stand trial population in California. There is a long wait list, people who are waiting in our jails several months up to much longer, simply waiting for services, waiting for competency restoration of our state hospital system. And so there are a number of states that have not only developed community-based alternatives, but have been doing evaluation of those community-based alternatives and seen promising outcomes, not only improving mental health outcomes, but also reducing costs. So we've outlined a number of recommendations, and there's been a lot of talk and a lot of interest in this budget season around better understanding opportunities and then potentially funding those opportunities. So the commission has been supportive of that as well. The fourth recommendation, what we are asking of the local communities to do in terms of looking at systems broadly and collaboration and understanding how we can potentially merge funding streams. We're also asking for the state. We're asking the state to model that leadership. And Secretary Kernan is the chair of the Council on Criminal Justice and Behavioral Health, which is the formerly known COMEO. And so the council has been instrumental in really helping to better understand how state leadership can support local efforts, whether that's better understanding policies and practices that are preventing communities from doing this work, and then also communicating best practices. And then the fifth and sixth recommendations are really around data and training and technical assistance. And data and training and technical assistance can help support the other recommendations that we're putting forward. Right now, it's unclear. The data, it's difficult to calculate because of a number of different reasons. But it's difficult to calculate how many people with mental health needs are in our criminal justice system right now. And so there's an effort that the board, the commission, the various different county associations have been involved with in coming to a consensus around a definition for serious mental illness, all with the goal of improving the way that we do our data collection. Finally, the last recommendations around training and technical assistance. We have heard from law enforcement partners that they simply just do not feel equipped to meet the needs of somebody who's in psychiatric crisis in the community. And on the other side of it, we've heard from mental health clinicians that do not feel equipped to work with somebody that has a significant criminal justice background. And so this recommendation is an acknowledgement that we need to do better in terms of how we support our professionals and recognize that they are, because of a number of reasons, increasing their contact with folks in the community. We want to make sure that they're prepared to do that. So those are the 6 recommendations. Very quick overview. This is my contact information. There we go. Please feel free to reach out. You have our hard copy. I would be happy to answer some questions that you may have if you have anything for me or Commissioner Chilbron.
Thank you so much. Thank you for your presentation and your work. It's very encouraging and exciting. My sheriff has used much higher numbers in describing the amount of folks in jail that are have some mental health issue that appears to be serious enough that it's causing problems. So I'm curious the disparity with the 17% serious. If you have some thoughts on that, because our sheriff has been pretty consistent. Hello, Sheriff Brown. And congratulations on your installment and your remarkable success. My sheriff is Donnie Youngblood, who I have a great relationship with, and we've had this conversation a lot of times. And he usually uses a figure around 60-70% with mental health issues. So I'm curious about that.
And that's probably very accurate. The 17% is SMI, serious mental illness, chronic, ongoing, people that are at the high end of that spectrum that are having more and more difficulties. Just to give you an example, we did a snapshot of the Santa Barbara County Jail, and we found out that more than 50%, close to 60% of the people who were in our jail had had some kind of contact with our behavioral wellness department in one way or another historically. So it didn't necessarily mean they were actively being treated, but there was some kind of interface with the system over that time. So, the people who are actually suffering from some type of mental illness, whether it's a form of depression, and let's face it, being in jail is a pretty depressing situation for a lot of people. It's when they hit rock bottom, and it's a very, very difficult time for a lot of people that are in there. So the actual numbers of people that have some kind of mental illness are probably much higher. But the SMI, the ones who are typically in crisis or causing severe disruptions, or who are engaged in the most concerning activities out in the community.
Wow, and with that categorization, 17%, that's pretty harrowing to think about, because it's such a complicated and high needs population to sort through what's happening there.
Right.
Sheriff, do you see, when we started out the Prop 47 process, we went all around the state and listened to the community, various aspects of the community as to how we should think as a methodology about how we give the money out and who gets it and why and what are we doing. And we heard consistently, part of what was presented today, that the jail setting may not be the best setting for mental health services. And I think at that time it was much more of a sort of loaded accusation, if you will. It seems to me that from this presentation that there seems to be a little more agreement on that, perhaps. I'm curious about your own sheriffs who really are elected to do, public safety in their counties. If you see some movement there, or is there some buy-in, and how do you see that piece playing out?
I think certainly California's 58 sheriffs, I think you'd be hard pressed to find a single one of them that thinks that mentally ill people should be kept in jail, that that's the best place to them. The reality is there's going to be a certain number of mentally ill people who are going to have to stay in jail. They've committed very serious crimes. They're a danger to the public. They probably are going to have to be held in jail. But there are many, many others who have this co-occurring substance abuse, who have issues of homelessness, who get into repeated situations out in the community where people are calling because they're acting out, people are scared of them, they are doing things that are the typical types of activities that people who are mentally ill will engage in, and their mental illness is driving them to cause disturbances, perhaps to assault people in a minor way, to steal items from stores, that sort of thing. And those are the people that typically have entered the system because there's really been no other way to deal with them in the community. The community-based treatment and resources have diminished and are really not there. And as a result, because you get somebody cycling through. I had a time when I was doing a presentation about mentally ill people in the jail. I was on my way to give that presentation. I was stopped by a homeless man who told me, "Hey, Sheriff, I've been in your jail 48 times. So 48 times, and I went and researched it. It was drunk in public, disturbing the peace, all batteries, all these types of things that you would think would be driven and fueled largely by alcohol and substances, as well as underlying mental illness." And there's a lot of people like that in our community. And what we're trying to do are focus particularly on those repeat customers, if you will, that keep coming back into jail. And if we can get them treated properly in the community, we'll break that cycle of them coming in like this revolving door in jail.
Sheriff, thank you for your leadership. I was a public defender in my former life. Don't hold it against me, please. But I was always stricken with my clients who were incompetent to stand trial. When they would go to Patton and then come back, it was a literal different human being that I was dealing with. It was hard to believe that I was even experiencing what I was experiencing, because the differential between the pre-treatment individual who is not remorseful, in my experience, was not remorseful or even honest about what has gone on to get him in this place. And this other person, literal other person who would show up after Patton, I would find overwhelmingly remorseful, embarrassed, wanting to improve their condition of their lives. But the difference between these two people, if I didn't experience it myself, I don't think I would believe it.
It's remarkable. And one of the things that we saw, one very successful program in Florida that we saw was where they have a program which is kind of a step-down program. If somebody goes into jail, they're really not ready to be released into the community, but they're not a good prospect for a long-term jail term either. So they have forensic mental health facilities that are locked facilities in the community. That person goes from jail for a fairly short period of time, a matter of weeks maybe, into a forensic mental health facility where they're not free to leave, but they are, in essence, a captive audience who has someone who can sit down and talk to them and explain exactly what you just said. And if you get the right treatment, if you take the right medications, if you are put in the right regimen, you can regain control of your life. And so then they're only confined for a short period of time, and then they go into community-based treatment that's not locked up. And so it's a progressive system that can step down. And those are the kinds of things that we need to explore here in California. It's more difficult for us because we don't have a statewide system. Every county does things differently. And a lot of counties don't have the resources to do a lot of things. So we're gonna have to look at regional approaches and look at different ways of doing things. But definitely there are ideas out there that work, and we need to really engage in the research process to make sure that we find out what they are and try to start implementing them.
Wow, how's fantastic. Sheriff, my last question is, do you see us going back to where we were before? You indicated in the opening of your presentation that jails have become the de facto place. This is what my sheriff says as well. He's said it 100 times. So obviously that's a change in what the system was. Do you see us, and do you want us really, as a policy expert, moving back into what we were pre-jails becoming the de facto, or is this a different direction altogether? Are we, is this all new, or do we like what was happening before the de facto scenario?
I think you'd be hard pressed to find anyone that really liked the way it was before. I think that's what probably prompted the change in the system. But sometimes the cure can be worse than the disease, and I think what we have to look at realistically is that we do have severely mentally ill and chronically mentally ill people who are actually dying on our streets because they're not taking proper care of themselves, and they are sometimes victimized by other people and so forth. So personally, I believe that if there is an expansion of facilities that can accommodate people who are so mentally ill that they're a danger to themselves or other people, in a more humane way than just saying, go and live under a bush or go and live under a bridge. I think that's probably appropriate, but not the wholesale reversal of having, large-scale mental institutions for people. We have to not give up on people. We have to and recognize, just like your former clients, there are people who can be revitalized and who can turn their lives around, and we need to look for ways to do that. I think the short answer to your question is I think we do need some more. We don't have enough crisis beds, and we don't have enough longer-term beds. In Santa Barbara County, we have 440,000 people in our county. We have 16 beds in locked facilities in our county. It is totally inadequate. It's really a reprehensible situation. But so, do we need more of those types of beds? Yes, but not so many that we're going to give up on everybody that we can have a chance of turning around.
Sheriff, thank you so much. Thank you.
I'm curious, and first of all, I just want to say anybody who's been working in the system in any capacity for an amount of time, I think will say amen to this report, because I agree with everything that you've said. I'm just curious, there's no mention of juveniles in here anywhere. And those of us that are responsible for detaining juveniles can tell you that exactly what you're talking about is happening with juveniles as well. There's legislation this year, there was last year too, to address the competency issue, because unfortunately the code is not clear when it comes to juveniles. There's some things that need to be made more clear, but it's the same issue of not having, facilities to treat them in the community. And it's interesting to me, and I'm 32 years, so back in the day, they wouldn't even diagnose a kid with a DSM, diagnosis. And so now we see full-blown schizophrenic, bipolar, very, very seriously mentally ill kids. That's the presenting problem, not delinquency. And the same problem of where do they go, or what do you do with them? We're not equipped, and nor is it the right way to treat someone with that kind of mental illness in a locked facility like that. So I'm just curious, is there any plans for the future to include juveniles in this?
Sure. So the original decision was just based on the resources that we had at the commission, our capacity to do a variety of activities. A lot goes into these policy research projects, and so we wanted to make sure that we weren't overcommitting ourselves, and that we would be able to do something that would be manageable given our resources at the commission. But in terms of an additional project on juvenile justice, it would really be up to the commissioners. If that's something that you would like to let our commissioners know as a need. How we get work at the staff level is our commissioners directed. So it would be directed through the commission, and staff would receive those assignments. But absolutely recognizing there's a huge need in our juvenile justice community, our juvenile justice system.
I want to thank both of you for the presentation. I'm a big believer of the Stepping Up initiative and getting that going. A little bit of concern though, because in many counties, my belief is that the jail and behavioral health should be the lead agencies in this movement, with probation as a major partner. In many counties, you're seeing probation having to be the lead because for some reason behavioral health in the jail aren't taking the lead. And so I'm just looking for some advice for not only my county, but other counties that are facing this issue where, maybe they're getting together and they're collaborating, they're having a conversation, but nobody's willing to step in and say, I have these funds, let's pull our funds together and work together on this. So I'm just looking for advice from both of you.
You're doing Stepping Up in your county?
We are doing Stepping Up, we're having good conversations, but we're not having movement.
Who's the lead on this?
in probation.
So that often unfortunately drives maybe how things are developed. But, in our county, it's the sheriff, it's me that is the driver, really the head of the 7-Up initiative, and it's brought people together. I don't think that it has to be, I think it can be any one person being the lead. The whole goal of stepping up is to recognize that it's a shared effort. We have to come together. No single agency can do it alone. We have to, get everybody at the table, get them bought in, and get collaboration and consensus on how the approach has to be. So personally, I think it doesn't matter what discipline that leader is in, and that leader just needs to bring people together and try to get them on a common cause. And really, that's how the problem's going to be solved, not by one agency, it's by every agency.
And just my own, what I would suggest, if this is possible, if there's some possible way that you could use data in order to support. So we saw that when we went to San Antonio, Texas. There wasn't a whole lot of buy-in in the very beginning until they started to look at the data. They started to look at who was actually driving the costs, who was actually, who were these, the high utilizers of systems. And in order to make this case that it's not just a criminal justice problem, or it's not just a behavioral health problem, that it's really these folks that are utilizing multiple resources. And if at all possible, if there's some way that you can use the data to support additional buy-in from partners.
I agree with you 100%. I have a great analyst. We have all the probation data to show for the mental health cases that we have. Unfortunately, on both sides, behavioral health and the jail, it's taken a very long time. I question their commitment to it, but they're still involved, which is a good thing. I've even offered my analysts to go into their systems and pull the data, and that's been turned down. But I don't want to labor my own issues, but I do think these issues are out there in other counties, not just mine. But thank you very much.
Madam Chair.
Yes.
First, thanks, appreciate it. A few questions. Where do we get more copies, hard copies?
I have 2 more.
Can we?
I would be happy to send you more.
Okay, whatever you
They were
need.
these, it was as much as I could pack into my bag to bring on the plane with me.
It's interesting, Chief Martola made the comment, there's this philosophical belief in so many places, including the state, that once somebody goes into jail, not only mental health care, but medical care is nobody's problem but the sheriff's problem. And Medi-Cal funding is a classic example of that, all those services we could lose, all the services we do lose when they come into custody, and that handoff and that transition becomes so much more challenging as we try to bring these 2 different forms of mental health and healthcare providers into a custody facility. But it does exist. Groups seem to wash their hands. What's trauma-informed correctional care?
So it recognizes that our jails are not necessarily friendly places. For people that have a serious mental illness, they can be very frightening, very traumatizing. We see that in some cases it presents a problem for safety for correctional staff. So if somebody who has a severe mental health need becomes agitated, overwhelmed, and maybe even starts to have hallucinations or has some kind of psychosis disorder, and there's a potential safety risk for correctional staff. There are a couple of different trauma-informed correctional practices that recognize and kind of work within the limitations of a correctional setting. Obviously, you need to have the lights on. Obviously, you need to have open spaces. But there are ways and policies and practices that can be implemented that reduce the possibility that environment can trigger somebody that has a serious mental illness.
So it's training on how to better deal with it. Interesting, we're building a 60-bed mental health facility, and we've had UCLA come in and do everything about when to build a facility, how to infuse the right music, use the right colors, how to position the beds, and significant studies on how effective that can be to reduce, the trauma. And if we give an inmate with mental health issues a dime or a banana, they seem to really be compliant on taking their medication. Mm-hmm. Who knows why those work, but so that's what trauma-informed care is. And then my last question, so Bill, I made the comment about effective models. So this, in looking around in that alternative to a custody facility, is the step-down model one that you've seen that might be the most effective as we talk to our counties about where we could best spend our money?
I think that has tremendous potential, but it would take probably some changes in the law, it would take some issues in California to do it, I think. But probably what I think was the most impressive single location that we saw was what they're doing in San Antonio. They basically have developed a one-stop shop for people who are mentally ill, and they encourage law enforcement agencies that come into contact in the field with someone who's in crisis, someone who has either got suicidal ideations or an attempt, and someone who's really going through a struggle. To instead of taking that person to jail, talk that person into the car and say, "Can I take you somewhere and get you some help?" And the officers or the deputies transport that person to this one-stop shop mental health facility. And the goal is to do a turnaround in 10 minutes or less for the officers. They're back out on the street. They're available for calls for service. They're not tied up for hours and hours and hours as they currently are. And when that person comes in and is received at the mental health facility, they're evaluated on their initial intake. And whatever their need is, they pretty much have the ability to take care of them in the short term. So if they're intoxicated, they can go into a sobering center. If they need a detox center, they can go into that. If they are in crisis and need to be sort of equivalent of a 5150 situation where they need to be in a locked facility, there's a portion of the facility that's locked. If they just need counseling, there are counselors there to talk to them. If they need housing, there is a housing facility that is literally across the street. That is an incredible facility that was made possible by a lot of generosity in the community. And they just got really smart about putting all of this together. And again, combining those resources so that you have this, and it's going to be hard, San Antonio's a big city, it's going to be hard for that to be replicated in a lot of areas, and a lot of counties can afford it, but I think on a smaller scale, we could still do a lot of that in our communities. And for me, I think that's what holds the most fun.
Thank you.
Yeah. There were some public-private partnerships that were enormous. The one we saw in Miami, I believe, was underwritten by Princess Cruise Lines. And it had layers of assistance for this population it was really impressive. I also think important to note, and you suggested this, is the cost-benefit analysis of doing this work differently and recognizing if we continue to take that drunk on the street, in and book him and then release him, and the facility they have for that was impressive alone. They literally were bringing in people and allowing them to sleep it off repeatedly with enormous patience time after time, and eventually telling us that after they had done that, and not booking them in, when they wake up, they can head on down the road, but eventually they would ask for help because they've been there 11 or 12 times. They're not complicated solutions, and to some of those solutions, there are no barriers. Understanding that locked facilities in California, there are barriers that we need to address as a state, because we can't do the right thing because we can't lock people up unless it's in a detention facility, and that is not the alternative we all know should be out there.
I also think it's important to note, though, that I agree. These people with these illnesses shouldn't be in custody, but absent creating alternatives, some of the reason these young people are alive is because they get booked for being drunk, and they get great health care, and they get fed, and they may only be in there for a couple days, but that could be the best meal and the best health care that they're going to get for the previous 6 months. So I'm not saying that's the right place to be, but in the meantime, we do take really good care when these people do come into our system.
Yes.
I've heard all of you actually refer to some of the site visits you did. Is there a list somewhere of the programs that you visited? Was it in the book? I didn't see it in here.
Sure. So it's on our website. I'd be happy to send, I can send Adam lists of all of our materials. We have summaries of all of our meetings, site visits. So we'll have a write-up of all the site visits that we visited, and all of our public hearings, all of the testimony, all available online. And so I can make sure that Adam gets that link, so you all have but we have a whole bunch of material on our project page.
Yeah, I'd be interested in the site visits and what those programs are.
And anybody else from the board? I think in closing, I don't think this discussion between your efforts and ours is going to go away anytime soon. I'm really glad you're here. The presentation was super valuable, but I believe really it's the beginning of what we need to do together. When you look at the intersection of the BSCC with your efforts, it goes on and on and on. And I mean, I'm really proud that the board is a part of that. Yeah, but we now need to look at the next steps. How do we continue the conversation and move the agenda that we're all aware of? I think the sheriff made a great point. When we talked about Burn Jag, we all know what's going on in this room. Is disseminating that and making sure it gets out there in the field. This is a great report. It's an easy read. The recommendations are not rocket science. No offense to those of you who put it together, but it's synthesized in a way. Yeah, no, it's.
And it's actually great that you say that, because through our process, we intentionally did not want to come up with something that was rocket science, right? Like we wanted this very much to be something that you were a part of, that the board was a part of, that the communities were a part of in formulating those recommendations. So thank you I actually take that as a great compliment.
Yeah. I mean, it's a handbook that's easily, and rocket science probably not the best use of words. I'll take the pin for that today. But it's important work. And, we look around at even who's on this board, CDCR's in the house, parole's here. All of us have this interface. Police departments, sheriffs are the front line of this effort. And we continue to have polarization. We continue to have behavioral health, and medical services will throw their hands up when they go into a detention facility. We got to work hard on that. So appreciate your remarks today. In an effort to continue the conversation and show how the BSCC interfaces, I'm going to thank you and allow you to sit down and invite Yvonne to step up. Going with stepping up.
Linda, Sheriff, can I just make one last one? Sheriff, we are in Kern County in the process of starting a program at our local jail that we've seen be very successful in a couple of the prisons that we have, which brings dogs into the prison setting, and then the inmates, those that are selected and appropriate, train the dogs and keep them for a period of time. Some of them have gone home with them. And I've been so stricken by two things. One, many of these guys are reconnecting up with their families through Facebook because the organization can post photos, can update what this particular inmate is doing with his dog and how their own personal evolution has been affected. It's connecting people to their families, so they're targeting folks that are going to be out for 6, 9, 12 months, family ties having broken down, and sort of reconnecting and showing a positive thing that this person is doing. It has been extraordinary. And secondly, according to the correctional guards, the places where the dogs have come into used to be, frankly, filthy, trash everywhere. They could smell cannabis, if you will. And now you walk in and, it looks like, luxury living, because the buy-in from everyone there is improving the environment to everyone who's experiencing it. And the guards are buying in because it's improving their safety, their quality of life, their anxiety and stress. So I think that critical piece of the buy-in from our correctional staff, who are really on the front lines of managing their own safety and the well-being of this entire institution, I think is so critical. And to see that happening is very exciting to me because, I think we got to get everybody closer to that center space where we actually buy into what's happening. We're just not enforcing more rules and stuff that really, if there isn't buy-in, isn't going to be successful. So I'm really excited about that. We're working with our sheriff to transition that into the local jail as a means to really improve the lives of everyone in that institution. That it's stressful for everyone. And that's just, it's a lot of negativity to manage.
You're absolutely right. You'll be happy to know that many counties across the state are looking at and implementing canine inmate programs that do work. I mean, there's no better deliverer of non-judgmental, unconditional love than a dog. And for many of these inmates, it's the first time that they've really had the responsibility and understand that they can get that from something, and it does turn their lives around. And we're actually looking at implementing that program in a year when we open our new jail in Santa Barbara County, and we're working on a partnership with the Humane Society to not only do the canine program and the adoptions that result from it, but also to take inmates in the latter part of their incarceration and actually have them do work at the Humane Society facilities and learn how to become dog trainers and dog groomers, and actually gain a vocation that they can perhaps turn into a job when they get out of custody. So it's a very, very promising program that many communities are looking at.
Well, to your point, as Louis V said, dogs, we love them because they know but do not tell, right? And I think that's appropriate. Anyhow, I'm so pleased and so touched by your presentation and the work that you all are doing, and just so grateful and excited about the direction we're moving together, as one community to address these issues and honor the taxpayer.
Well, thank you, and thank all of you for your attention and interaction and engagement today. It's an exciting project, and we look forward to working with you and with other entities across the state to make this a reality.
Thank you.
Thank you.
Just as evidence of Supervisor Perez's excitement, she sent me a note and said, "This is so exciting." I shall now post that on my gavel. And as another appropriate segue, I'm going to invite Yvonne forward. The BSCC has oversight of training of correctional officers in both adult and juvenile facility, as well as probation officers. And so there's been a lot of work done in our agency, primarily by Yvonne. And of note today is that Yvonne is a new dog owner, so I think it's a good all the pieces have come together, and Yvonne, you may take it from here.
Yeah, I agree with you. I think an area of intersection between the wonderful work of the commission and this board is in the area of training. And this board currently has an executive steering committee chaired by Chief Rtola that has been charged with looking at the training standards for our entry-level corrections personnel. So that includes our adult corrections officer, our juvenile corrections officers, as well as our probation officers. And through all of this work, we heard a lot of the things that were reported here by Ms. Knowles and by Sheriff Brown regarding the proportion of folks in our facilities and on probation with mental health needs. And what we heard from corrections staff as we talked to them about this is they really felt ill prepared to deal with the population. The training that they were receiving wasn't enough. It wasn't the right training. And through that process, we really heard that this is the big area of gaps. So there's lots of gaps in training that need to be addressed through this effort. But that biggest gap and the biggest need that we heard over and over and over again was around behavioral health training. And it wasn't enough just to form a behavioral health unit that could be given to everyone, but it was so important that it needed to be infused throughout core training. So we really approached the behavioral health training development with sort of this two-pronged approach. One was, how do we do that? How do we infuse behavioral health training throughout core? And then the development of a standalone behavioral health unit. And through the wonderful participation of our state subject matter experts, those who perform the jobs, those who manage those who perform the jobs, those who administer the programs, behavioral health experts, all these folks came together to help us answer those questions. And we were able to infuse about probably close to 200 performance objectives throughout our core that have some sort of behavioral health implication. So if you can imagine in the class on booking, there would be some attention to doing some sort of assessment around behavioral health needs as someone's coming through. So that's infused into a booking class. But then we also looked at what sort of standalone training do we need for behavioral health training. And bringing all these experts together, we came up with, or they came up with, I just happened to be their same great idea, but they came up with training in all kinds of areas. It's probably about 20 to 24 hours worth of training in topics and other classes such as trauma, we talked about that earlier, substance use and co-occurring disorders, stigma and bias, crisis intervention and de-escalation, emotional survival, safety and liability, suicide prevention, and behavioral health case planning for POs and JCOs. So it's a very broad behavioral health training module that we also took a step further on that as well, because typically what we do at the SCC is really understanding all of the different needs across the agency. We develop training standards at the performance objective level, meaning we tell you what needs to be trained, but the content really is determined by the agencies delivering it so that they can build in all of their own policies and practices related to those things. But what we heard from folks as we started talking about this particular topic is that we needed more standardization, that it shouldn't be left to people to fill in the blanks, but that we should really develop a much more prescriptive module of training that would be available to everyone, since it is such a big need and there is not a lot of resources out there as it relates to the training specific to corrections personnel. So we took it a step further, and we now have entered into a contract with the University of Colorado to actually develop that unit of training. So it'll be about 21 to 22 hours worth of training as they sort of sort through all of the requirements of it. It will be a lesson plan that someone can pick up and deliver if they meet the required instructional criteria in order to instruct that class. We are going to roll it out with a T for T so that agencies who will be delivering it will be trained on how to deliver that curriculum, and then that curriculum will be widely available to our agencies so they can deliver it to their folks. And although it will be designed for core training, it can be used for any staff. So they can also use it for annual training or to provide at any time. And we will be maintaining that lesson plan and ensuring that it continues to get updated and revised as the needs change in the field. So we're doing a lot of work in that area, and we're hoping that we'll be able to come to the board, hopefully maybe in the fall, with all of the recommendations, including recommendations on this behavioral health unit for your review and approval.
Thank you, Yvonne. Any questions from the board? Because I'm not above doing another really naughty thing. Jessica, in the back room, who's trying to sheepishly be back there, and here is the new ledge person for CSAC. Would you mind just standing briefly? I promise I'm going to be polite. I'm so happy you're here for this discussion, because as we talk about polarizations that you find on the local level in counties, a person that's going to have the ear of all of those individuals, and we look towards you to help us with breaking down some of those barriers in the area of the polarization between behavioral health, criminal justice, and medical services. So welcome to your new job, congratulations, and we're glad we could have you here for this briefing. Anything you'd like to say to us then?
Thank you for the introduction, and I look forward to working with them.
Great.
Madam Chair?
Yes.
And I apologize for missing part of the presentation. When we talk about training for correctional people, and I'm always concerned about the extra burden, especially if it's already happening. So for me, my deputies work in the jail, but I send everybody through a 40-hour CIT training program. And so it would be, I don't want to be unduly burdensome on agencies that already do that.
It's great. It's great. And now to share with the body, my next post-it note says, the room is being made warmer. I don't know if that's on an emotional level or you're here, but I'm going to go with both. Yes. Stack of stickies. Anybody else wants to get that sticky up here? I don't put anything embarrassing because I'm prone to reading it. Okay, so I think we've finished the presentation portion of the agenda. Now we will move to the formal part of the agenda. I'd like to remind everybody in the room, if you choose to speak on a particular matter or on just anything that comes to mind, you need to do a speaker's card and share that with Tracy up here. And with that said, I would invite everybody to look at the consent items on the agenda today. And I would request approve. Yes.
Under the minutes on the first page, I just want to make sure that this is accurate. In that last paragraph, it says the governor's budget did not include $9.2 million for the Cal VIP grant.
That is accurate, yes.
It was just confusing because then it went into the BSCC issued the Cal VIP RFP on November 13th.
Correct, for last year.
Last year's money.
Yes.
So you want to make sure
It didn't go forward.
Got it, thank you.
And of course, that could change, during the budget process, that has happened in prior years. So I was only summarizing the January governor's budget.
Right, so I just want to make sure it was accurate.
I'm glad you asked.
Motion to move consent.
We have a motion, can I have a second?
Second.
Motion and a second, all in favor? Opposed? Abstained, motion carries. So we will now move on to discussion items. We begin with Cal VIP, and I would invite Pauline. We didn't let you sit with your colleagues, Pauline. But just remember, the room is getting warmer.
Madam Chair, before we begin this item, I would invite board member Warner to excuse yourself. The City of Sacramento is in line to receive a grant, and as an employee, she may have a remote interest with the new government code section 1091, so we'll ask her to step out and recuse herself.
Goodbye, Francine, we'll come find you when it's time. Yeah. Good luck.
All right, good morning, Madam Chair, members of the board. I'm Colleen Curtin with the Corrections Planning and Grant Programs Division. Agenda item B requests your approval of 20 new grant awards under the California Violence Intervention and Prevention Grant, or CALVIP, as recommended by its Executive Steering Committee. And I'm going to go for a few slides today, but most of the information is in your board report. Funding for this grant in the amount of $9.215 million in general fund dollars was authorized by the fiscal year 17-18 State Budget Act. The authorizing statute mandated that BSCC offer a non-competitive grant in the amount of $1 million to the City of Los Angeles, and further specified that the remaining $8.215 million be made available as a competitive grant to California cities and community-based organizations. This is noteworthy because under the grant's predecessor, which was the California Gang Reduction, Intervention, and Prevention Grant, or CALGRIP, only cities have been eligible to apply. So this new legislation opened it up to CDOs. The Budget Act further specified that a grant shall not exceed $500,000 and that each city that receives a grant must distribute at least 50% of the grant funds it receives to one or more CDOs. A dollar-for-dollar match, either cash or in-kind, is required from all applicants. Board member Michelle Brown served as chair of the CalVIP Executive Steering Committee, which convened on September 28, 2017 to finalize the request for proposals, or RFP. The ESC decided that of the $8.215 million available for the competitive grant, half would be made available to cities and half would be made available to CDOs, roughly $4.1 million each. Applicants will be scored in part on how well they can demonstrate that the program or strategy they propose to implement is one that has already been shown to be effective at reducing violence. Preference would be given to applicants in cities or regions that are disproportionately affected by violence. And in defining disproportionately affected by violence, the ESC considered crime data reported to DOJ by cities for 2015 and 16. And we looked at crimes classified as violent by the FBI's Uniform Crime Reporting Program to include homicide, robbery, and aggravated assault. Preference points were assigned to cities and to CDO applicants that proposed to provide services in those cities that ranked in the top 5% statewide for their homicide rate, robbery rate, and/or aggravated assault rate. The CalVIP RFP was released in November with a proposal due date of January 22nd. The BSCC received a total of 121 proposals, requesting $55 million. 91 of those coming from CDOs and 30 of those coming from cities, with one CDO dropping out. Since it would not have been feasible for each BSC member to read and score all 121 proposals, giving equitable consideration to each, a multi-panel rating process was used. And this process consisted of taking the 12-member ESC, dividing them into 4 panels of 3 members each. We took care to divide the expertise or spread the subject matter expertise among those 4 panels, with each containing 1 representative from law enforcement, 1 CDO provider, and 1 other, either from academia, advocacy, etc. 5 proposals, referred to as overlapping proposals, were read and scored by all 4 panels, so that our research division could assess 1, the extent to which raters provided comparable ratings across the 4 panels, and 2, inter-rater reliability across all raters. The remaining proposals were randomly distributed across the 4 panels, making sure that each panel had a representative, proportionate amount of city and CDO applications. On February 27th, 2008, members of the ESC attended a rater training at which they reviewed the RFP and rating criteria, received training on how to use the BSCC rating forms, and participated in a mock rating exercise. The ESC was given approximately 4 weeks to read and score the proposals. After the ESC members' preliminary ratings were submitted, BSCC's research division ran a series of analyses to assess the consistency and differences in ratings across all ESC members for the overlapping proposals and within the 4 panels for the remaining proposals. The analyses informed whether the raters were providing comparable ratings for the same proposals. The analysis did show some inconsistencies and differences in the ratings, and these were the focus of the final ESC meeting. On April 3rd and 4th, ESC members convened to discuss the proposals and their preliminary ratings and had an additional opportunity to evaluate the proposals. The research division assisted with guiding these discussions. During this discussion, ESC members were permitted, but not required, to change their preliminary ratings. Following the discussion and after any rating changes were made, the final proposal scores were calculated. For the multiple panel rating process, final proposal scores are calculated as standardized scores. The use of standardized scores is an accepted common methodology for various multiple panel processes in applied settings. Standardized scores makes it possible to compare scores from different panels and minimize differences. Standardized proposal scores substantially reduce the possibility that a proposal would score higher or lower only because of random assignment to a particular panel. At the end of this last meeting, once the standardized proposal scores with preference points were calculated, 2 ranked lists were generated, one for city applicants and one for CBO applicants. The ESC is recommending awards to the highest ranked applicants on each list based on the standardized scores. I want to take a moment here to recognize Casey Wormuth, who's here today. She's chief of BSCC's research division. She and her staff worked tremendously on this effort in developing and overseeing this multi-panel process to ensure that the methodologies we use are accepted field standards. And I also want to recognize and thank Chief Probation Officer and Board Member Michelle Brown, who provided consistent leadership, advice, and support throughout this 1.5-year long process. Thank you, Chief. Proposals recommended for funding include 10 submitted by cities and 10 submitted by CBOs. The city proposal and CBO proposal that fell at the funding cutoff on the ranked list are being recommended for partial awards based on the availability of funding. If the proposed list of grantees is approved, the 2-year grant period will begin May 1, 2018 and end April 30th, 2020. List of city proposals recommended for funding is shown on the slide here and in attachment B2. A list of CBO proposals recommended for funding is shown on the slide here and again in attachment B2. Proposal summaries for those recommended for funding are provided as attachment B3. In conclusion, on behalf of the CalVIP ESC, staff recommends that the board fund the City of Los Angeles for a $1 million non-competitive grant as was authorized in statute. Fully fund 9 city proposals and 9 CBO proposals for programs and initiatives to prevent and reduce violence. And partially fund the City of Pasadena and the Young Visionaries Youth Leadership Academy, both of which fell at the funding cutoff points on the city and CBO ranked lists, respectively. In the event that a grantee is unable to accept the conditional award, we request that the board authorize staff to accept relinquished awards and offer conditional award to grantees next in line on the rank order list. And that concludes my presentation. Are there any questions?
Any questions from the board? Yes. Well, first of all, I just want to say Colleen's always a rock star, and I'm always so impressed at her memory, the detail. Just a fantastic job. This was, what I've done a lot of different ESCs over the years, and this one had a lot of proposals. And I'm hopeful that, we're going to continue to see this volume of not just government agencies, but CBOs applying for things. And so I was so impressed with Casey and the others from, research on the inter-rater reliability and standardizing the process and scores. And I just think it's really, really important because I think it's setting really the groundwork for what's going to be necessary in future ESCs for being able to have an expectation of people reading that number of RFPs coming in. And for anybody who's ever sat on one of those ESCs knows, it takes some time to read So you get 130, 135, and, there's gotta be a different way to do it. So I was so impressed. I mean, really, really impressed, and their ability to explain all of it so everybody understood what we were doing. So I just wanna say thank you, Casey, and everybody in the team, Ashley, and everybody that's involved.
Absolutely, and this was not on a Post-it note, but I too want to thank Colleen and Casey. The rollout of this new interreliable rating program was impressive, and when they explained it to me and I actually understood it, I thought it was super impressive. So we are going to, with confidence, go forward and use it and really believe we're going to get a better product. Because asking anybody, Chief Bejarano keeps nodding his head. I do believe we asked him to read 1 million proposals and then rate those. He never sent me a thank you note for that. So
We'll give him more stickies.
Yeah, on Post-its. That's all we have to offer. But so thank you for all your heavy lifting on this one, and I think we have a great product. Looking now,
Madam Chair, I just wanted to add one additional thought. Of course, joining the chorus of appreciation for Chief Brown and our tremendous staff on this. One of the things, I think I'm not the only nerd in the room, but one thing I just wanted to mention that I thought was great is that the members of the Executive Steering Committee did not know if they were reading a proposal that had come to their panel uniquely or was an overlapping proposal. So every single question that I could think to ask Casey and the other members of the team was, yes, we thought about that, and this is what we did. And it was really, truly impressive and great, I think, for all of us to learn more about handling these high volume grants when they do come through. So thanks again and great work.
yes.
Move approval.
Actually, can we go to public comment first? I often get in trouble from everybody. So I'm looking now to see if we have any dispute. We have none. So Sheriff Dean, I squashed you for no good reason, but could we now have your?
Just because they're on majority of face.
Well, that's it.
Move approval.
Second, all in favor? Opposed? Let the record reflect that there's an abstention. I'm Tara now from Sacramento County. We can invite her back in the room. Anybody want to find Francine? Nobody, I can't get anybody.
Hello.
Yeah, wow. See, there you go. Takes a village. Item C, Katie, I assume, oh, you and Mary, okay.
Yes.
Mary, I'd like to say that we hope that Rachel Rios would be here for this. She has a conflict and cannot be here today. So Mary, go ahead and take this item. Don't be offended by the fact I'm going to step away from it.
Good morning, Madam Chair and board members. I'm presenting on behalf of SACJAB Chair Rachel Rios on item C, which is requesting your approval of the State Advisory Committee on Juvenile Justice and Delinquency Prevention, which I'll now refer to as SACJAB, their new 3-year Title II state plan for 2018 through 2020. This state plan and the Title II federal solicitation can be found in your packets. This agenda item is also requesting your approval to submit the state plan, which also serves as your 2018 Title II application to the Office of Juvenile Justice and Delinquency Prevention, which I'll now refer to as OJJDP. I ask that we be permitted to work with Chair Rios to make any final technical amendments to the state plan before we submit it, should that be necessary. OJJDP requires states to maintain a state advisory group and to submit a 3-year plans with annual budgets and updates as a condition of receiving the annual Title II formula grant. SACJAB serves as this board's state advisory group and as a standing executive steering committee. There is a slide. Oh, I guess I did that. I thought it was magic. A slide of our impressive membership, which includes board member. There we go. It also includes Chief Brown, who's a member of SACJAB. And this body, because our current 3-year state plan ends in September of this year, it began its work under Chair Rios' leadership last summer. This development work included 2 listening sessions, one in Sacramento and one in Los Angeles, the distribution of a statewide survey to hear directly from youth and the community more generally about issues, concerns, and priorities for juvenile justice. And staff provided SACJAB with juvenile detention data from counties and information regarding current trends and issues in the field of juvenile justice. All of this information is included as part of the state plan in your packets. So this information, along with the subject matter expertise of the SACJAB membership and OJJD requirements, informed development and recommendations of the state plan. The state plan establishes the 2 highest priority needs within California's juvenile justice system, which you'll see on the screen. They are to keep youth out of the juvenile justice system by promoting community and family supports, and to promote youth success by reducing recidivism. Within those 2 priority areas, SACJAB further refined the state plan to identify 6 program purpose areas, which again you'll see on the screen. These are aftercare reentry, alternatives to detention, community-based programs and services, diversion, mental health services, mentoring, counseling, and training programs. The state plan will largely will largely fund local and tribal grant programs in those program areas. The state plan also sets aside funds for compliance monitoring and for reducing racial and ethnic disparities. Planning for the racial and ethnic disparities strategy will begin later this month when SACJAB's standing RED subcommittee meets for initial discussions. This state plan is one piece of a larger juvenile justice effort involving many other stakeholders. And I am asking for your approval of the state plan with our ability to make any final technical amendments so we can submit to OJJDP. And I'm happy to answer any questions.
Yes. I know that Rachel isn't here, and so I know that someone in here will pass this on to her, but Rachel has just been absolutely fantastic as the chair of SACJAB, and it's been so wonderful to go through this process, which was a lot of work, very little of which I did, but the number of meetings and the input, and Rachel's so good at making sure everybody was heard, everything was included, right up until the last meeting where there were some pretty significant changes made that were really important that Police Chief Mannheimer was talking about. So I just can't say enough about how really lucky I think we are to have her as the chair. And I would be happy to make the motion to approve this, although I know we have other comments.
Any further comments? And I too would like to thank Rachel for her leadership on this. She's really picked up the torch and run with it. I'm sorry she's not here today to present. Not that you didn't do an elegant job, but I was out of the room, so I don't really know.
I'll take it anyway.
I feel that Kimberly Bouchard also deserves tremendous gratitude for her work.
Great. I now look to any public comment on this issue. Do you have any speaker cards? Nope. Seeing none, I'll take your motion, Chief Brown.
Second.
We have a motion and a second. All in favor? Aye. Abstained? Opposed, I guess I should have said. Motion carries. On to item D, local jail construction funding program. I think we're going to discuss Siskiyou County requesting an extension. John Prince, how are you?
Good. How's everybody?
Great.
All right. Good morning, Madam Chair and board members. I'm John Prince with the CSC Division. I will be making a presentation for both agenda items D and E. Agenda item D requests that the board approve a time extension for Siskiyou County's project establishment for its AB 900 Phase 2 jail construction program. Some of you board members may recall that the county has asked for prior extensions from the board due to cost overruns and complications with their children's site, which have been granted in the past. The county has now resolved those issues and has made progress towards establishment, and is now requesting an extension in order for the county to comply and complete with their CEQA documentation related to this site change, which is expected to be completed and certified in July of this year with their County Board of Supervisors. So staff is recommending that the board approve the county's request to grant a time extension for establishment up until December 2018 from the current May 2018 deadline.
Sorry. We have one speaker card on this.
Sheriff John would like to speak on this.
Sheriff, I thought you might.
Good morning, Madam Chair, and other distinguished members of the board. I just wanted to thank the Board of State and Community Corrections for your consideration for this establishment of our project extension for the State Public Works Board. And I know you've been with us for several years on this project, but I think we have a lot of momentum. We have a unanimous support of our Board of Supervisors, our citizens support it. And what you're doing is you're not only enhancing public health and safety, for our entire county, but helping us bring this project to fruition. And I also wanted the board to know that we're working very hard in Siskiyou County on alternative sentencing programs, rehabilitation, programming services, and providing those services to the mental health care needs of our inmates, and providing education and developing things like a veterans court to deal with the veterans to get into the system. And we're also working with families and doing a lot of innovative things. And we're trying not to fill all the beds in our jail, but we sorely need this jail. We're always full. We have nothing but felons. And I wanted to personally thank the board for their consideration of this extension, and thank you for being with us every step of the way. And I also wanted to thank the BSCC staff for being so extraordinary in their support of not only the Siskiyou County Sheriff's Office, but also the citizens we serve.
Oh, thank you, Sheriff. You've had a rather busy year. It would have been hard to turn you down under any circumstance, but I'm super pleased that you've got some momentum going, because I know it's important for you to get this off the ground. So.
Thank you, Madam Chair. Thank you for the board. I really appreciate it.
Anything else?
I'll second it first.
Thanks for your input.
First, we have a motion?
So good.
Second, all in favor?
Yes.
Aye, opposed, abstained, motion carries. And it looks,
We'll just note that Mr. Bennett was absent from the vote.
I didn't get a sticky note on that. I'm able to acknowledge that. Thank you.
Moving on to agenda item E, which requests the board approve the use of an alternate site located within the same county-owned land adjoining the existing Mendocino County Jail. This will allow for the construction of a single-story building with a mezzanine as opposed to a multi-story structure. This site change will also allow for the retention of a 20-bed dormitory housing unit that is currently used for minimum security protective custody inmates in the existing facility. And that was originally to be demolished as part of the project. The continued use of these beds will allow for enhanced classification options for the inmate population within the existing jail. So staff is recommending the board approve Mendocino County's request for a scope change in order to change the location of the project and allow for the retention of the existing 20-bed dormitory housing unit that was initially planned to be demolished.
Yeah. Is there anything from the board first? Any public comment on that? Tracy, I guess there's.
Oh, yeah, no, I'm sorry.
So I'm looking for a motion.
I'll make a motion.
Second, all in favor? Aye. Opposed? We have some dissension on the board over here. Let's, any opposition? Seeing none, abstentions, none, motion. Well, and we'd still like to note Mr. Buddy's not in the room. Motion carries. That concludes the formal agenda. Now is the time we would invite any public comment. And we have some speaker cards.
I do, Madam Chair, there are 4 guests here today from the Time for Change Foundation, and they could come up and, I guess,
You
just
all
kind of
like, you want to come up together?
Yeah.
Come on up together. It would be a new and exciting moment. And would you mind introducing yourselves?
Yes, of course.
Thanks.
So, good morning, Madam Chair and Board. My name is Valerie Zermino. I'm with Time for Change Foundation. I'm the financial administrator. I have some of my staff and clients here with me. Would you like them to go ahead and introduce themselves?
Please.
Okay, perfect. Go ahead.
Hi, my name is Dawn, and I'm a client with Time for Change Foundation.
Dawn.
My name is Sarita, and I'm an ex-client and a policy advocate for Time for Change Foundation.
I'm Dominique Larry. I'm also staff with Time for Change Foundation.
Love your glasses.
Thank
you.
you.
I was thinking Trump would be time. Mine's so boring now.
She comes out actually. So we're here today, I know it's not on the agenda, but we wanted to speak about Prop 47. So Time for Change Foundation, we've actually been empowering homeless women and formerly incarcerated women as well since our inception in 2002. Our goal is to help these women become self-sufficient through our wraparound program, which will then entitle them to be, strong, independent women, which will help them raise their children better and their children become thriving. Right now with the Prop 47, without their funding, we would not be able to do all that we do. We have helped 1,150 women so far become self-sufficient, as well as 247 children be able to reunite with their mothers out of the system. Dawn will speak to that today.
I'm one of them.
Sarita also. So, we really wanted to come today and, come to the board and you guys be able to hear our voice. We're from San Bernardino area, but we work throughout the whole Inland Empire. We have 2 emergency shelters. Sheriff talked about it today that, we need more of them, and we really truly do. We have 13 permanent supportive housing units, as well as our own developed Phoenix Square, which is a housing complex that our women can live in once they complete our program. There is no time limit on our program. Our program allows women to come out of being formerly incarcerated and or out of maybe domestic violence relationships, substance abuse, all this stuff. And they come to our program and it allows them to meet with counselors. They have their case managers. They come and live at our house, our housing complex, and it gives them a new start to life, and it really helps their children. And now we're seeing these children thrive. All of these children, they come, with their parents or with their mothers, and they feel like, hope is gone. We give them the hope that they need. We allow them to go to school without a worry of where they're going to sleep the next day. Where are they going to be able to lay their head at night? Is it going to be cold? So, this funding for Prop 47 will allow us to help the women, which then helps the children. So I'll go ahead and let my girl speak on that. Thank you so much.
Thank you.
Okay, well, my name is Dawn, and I'm representing Time for Change Foundation. I'm here today to say that women and children are not invisible. We need Prop 47.
Can you put the mic down?
We need this funding to help women like me. I am a mother of 2 beautiful boys, but I also have a family. I work so hard to beat my addiction and to get my children out of CPS. And sometimes it feels like all this work was for nothing because I can't properly support my children because I can't find work. And so we're here today to make sure that women and girls are represented through this funding.
Thank you.
Okay. I know that Valerie also mentioned that we have shelters in Southern California, but recently we did expand to Northern California, where we also are going to have housing there for homeless women and children. At Time for Change, we offer hope for women and girls to receive shelter and to ensure that clients stay on the right track. We help women and young children take the right steps to achieve the ultimate success, which we believe is self-sufficiency ultimately. Funding is not only beneficial to men, but especially important to women and girls with children so that those children can receive a stable parent, and we all know that the teacher starts with the mother. At organizations such as Time for Change Foundation, we're able to offer job training, ensure shelter and care, and offer resources for counseling. However, without funding for Prop 47, these programs are limited to women and girls who have faced homelessness, addiction, and domestic abuse situations.
I'm Sarita, and I'm a product of Time for Change Foundation. I've heard a lot of things today that I took in major consideration, like I have mental health issues. I have gone through the domestic violence. I have gone through poverty and different issues, and people are missing the big point. The big point is that to me, like, mental health comes a lot from substance abuse. Like, not everybody is mentally ill, but by us being a substance abuse user, we tend to bring the mental health issues. What brings the substance abuse is a problem in our community. There's not enough funds for women and children. You take our kids from us, you put them in the system. We don't have family that's gonna support us, or either our family is supporting our children, so that now we can't go and live with the family, you know what I mean? So it just puts us in aspects in our life where we're hopeless. We have nowhere to go. We have no one to turn to. So 9 times out of 10, we turn to the drugs. Time for Change is a program that helps people like us. They help us with mental health, domestic violence, employment, helping us take our felonies. I'm also like a product of Prop 47, taking my felony and putting it into a misdemeanor, because at that time in my life, I was just doing things just to survive. It's not always about we want to commit a crime, we want to do this. It's about surviving. You know what I mean? So I just want to say, like, don't forget about us, mothers and children. I got my son out of the CFS system. It was hard, you know what I mean? But with support from Time for Change Foundation and the support that I had around me, I was able to go in the course after doing what you guys have asked me to do twice, not once, but twice, and you guys still didn't want to give me my son. If I didn't have the support of Time for Change Foundation, I wouldn't have my son today. I have full custody of him. I am now employed for Time for Change Foundation. I just want you guys to know that it works. For the 5 years, we have a 0 crime rate. So it does work if you help us out, these women and children. And I don't want you guys to forget about it. We're not just here like, oh, help us out, help us out, help us out, and we're not doing nothing. We're here showing you like it works, but just have faith in us. And you know what I mean? Our mothers are our future, because if our mothers are good for these kids, then our kids will grow up, and you won't have to put them in jail. You won't have to put them in mental health facilities and stuff like that. They can be productive members in society. Maybe some of you guys are on the board or something. Nice.
Great. Thank you.
Thank you so much.
Valerie, thank you for bringing, representation in and keeping this on the forefront. Important work, really important work. Congratulations.
Thank you so much for your time. I really do appreciate it.
Shay, can I ask the young lady who has 2 boys? I have 2 boys. You really touched my heart when you said that. How old are your boys?
4 and 2.
4 and 2. Oh my goodness. Well, I have almost 2 and then 7. So our little ones are the same age. How striking. And you indicated earlier that you've gotten clean through the program, and you look fabulous, and so happy you have your boys back. But finding employment, is a real challenge, I know. And I want you ladies to just take a look at Miss Tara Hunt in the back of the room there. Tara, could you stand up? Tara works in my office. She's a field staff in my office, and she was able to start working in my office through a Prop 47 program, or funded program, called I can't remember precisely, but for the first 6 months, Tara has worked in my office. And it was minimum wage, but they paid those wages so that we can get a sense about whether Tara has something to offer, right? In my office, if she's good, if she's competitive, right? And she has been absolutely remarkable, breath of fresh air, as I like to say. Tara has been in the system as well, to prison 10 terms. And here she is now 4.0 at our local community college, and she is brilliant and sees things and angles that I don't see, and has really added so much life, and it's such an asset to my office. Yes.
Can I just say something? I just want to, you know what I mean? Housing is also a issue in our community with mother and children. And let me open up my door a little bit so you can walk through it. I'm a mother of 6. I have 6 kids. I have 5 boys, 1 girl. I obtained custody of one of my children. My mom has my other 5. And even though I have good employment and I'm very blessed and I'm thankful for that, but housing is also an issue. Because when they look at me and look at my 6 kids, being that 5 of them are boys, and you know what I mean, in the community, and my criminal background, I'm always getting turned away, you know what I mean? So that's a major goal in my life, to have housing. It's not just about employment, it's housing too.
Where do you live now?
I live in Phoenix Square for Time for Change Foundation.
And how long will you be allowed to stay
There's
there?
no
Just curious.
limitation, right? But I have a
That's awesome.
1 bedroom. Let me implement, I have 6 kids, 6. I know that it was my choice.
Sure.
And I totally get that.
Right.
But with my, like I said, my criminal background and me having 5 boys, I get turned away a lot. Like, you know what I mean? And my goal is to get a house and you know what I mean? But it takes a moment to clear the records of my past. So housing, I just wanna, for me and the girls that I support at Time for Change Foundation, I wanna say housing and employment is a major issue in our community today. And we can help each other by not closing that door and not being like, okay, their testimony was there, but overlooking it. Housing for the community, that's a lot of reasons why people are out here doing drugs. That's a lot of reasons why there's so many babies in the system and people are just like here, mental health here, substance abuse here, domestic violence here, because people don't look at the housing. If we have stable housing, it will help us. If we have good employment, you can give us a good employment, and 9 times out of 10, you're gonna give us, let me open up that door just a little bit since you've given me that opportunity. You can give me a low minimum paid job. I have to pay for childcare. I have to pay my bills. I gotta pay for electricity and gas, food, and still be able to make it. That's a lot. Like, you know what I mean? I appreciate the fact that, you know what I mean, you might get a low paid job, but like, think about it from our perspective. We're women trying to like be better productive members in society as a good role model to our children. So when you think about that, just don't forget us, the women and children.
I appreciate that.
Well said.
Appreciate the work you're doing. Lots of barriers, but you're helping out.
So proud of you guys.
Anything else?
Keep up the good work.
Thank you.
Word? No?
Thank you
All right,
guys
thank
for
you
your
very much.
time.
Are there any other
Appreciate it.
public,
We have one more, Brian Goldstein from the Center on Juvenile Criminal Justice would like to speak.
Good morning, Brian Goldstein with the Center on Juvenile Criminal Justice. We appreciate the work of staff relating to the March 2018 Youthful Offender Block Grant and JJCPA annual report, but we have some concerns that we'd like to express. Just by way of background for the board, JJCPA and YOBG total approximately $280 million for local juvenile justice programs in a non-competitive manner for counties. Given where California is right now with our juvenile justice system, record low juvenile arrests, record low juvenile facility populations, we think this is an opportune time for justice reinvestment. Now, AB 1998 passed in 2016 consolidated reporting requirements. And when we look at the March report that was released, we have some concerns. The report lists county descriptions about programs, but there's no overview on the total number of programs or youth served by the state. Now, stakeholders and the general public, they're very interested in this funding. They're very interested in accountability, oversight, and understanding how the funding can be used. So we would like to ask if staff can provide a summary of the total number of youth served, the total number of programs, and associated outcomes. Again, this information was provided in the previous year's report, but it's not in this one, so we'd like to ask staff to do that. Thank you.
Thank you. Any further public comment? That's it? Okay, then I think we can officially adjourn the meeting. Thank you all for your participation and best of luck on your travels home.